Afternoon. It's 2 o'clock, and I'd like to open, and it's 2 o'clock on April 22nd, and I'd like to open the Littleton Board of Health meeting. This meeting is being held virtually through Zoom. The town of Littleton began conducting remote participation / Zoom meetings pursuant to the Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents with the chat room, which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so that their microphones are muted. If you called in by phone, please use *6 to mute or unmute your phone so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute, then state their name and address. After speaking, we request the participant return their microphone back to mute. Okay, so to start off today's meeting, I would like to approve some past minutes that we've had all typed up courtesy of Lisa Flanagan and Janet Fairchild. We're all up to date now. So let's first do a roll call for approving the minutes from April 1st. So Kevin?
Kevin Baker, yes.
We'll need to have a motion and second first.
Oh, I'm sorry. Can someone make a motion to approve the minutes from April 1st?
I'll make a motion to approve the minutes for April 4th, the Board of Health minutes for April 1st.
I'll second.
Okay. Kevin?
Kevin Baker, yes.
Lisa?
Lisa Flanagan, yes.
Mike?
Michael Zeldin, yes.
And Louise Nichols, yes. And now I'd like to get a motion to approve the minutes from April 8th.
Make a motion that we approve the minutes for the Board of Health for April 8th.
Is there a second?
I'll second.
Okay, Kevin?
Kevin Baker, yes.
Lisa?
Lisa Flanagan, yes.
Mike?
Michael Zeldin, yes.
And Louise Nichols, yes. And can I get a motion for the minutes dated April 15th?
I'll make a motion to approve the minutes, the Board of Health meeting minutes for April 15th.
This is Mike Zeldin. I second the motion.
Okay, so Kevin?
Sorry, Gino was calling me. He didn't get the meeting invite. Kevin Baker, yes.
Lisa?
Lisa Flanagan, yes.
Michael?
Mike Zeldin, yes.
And Louise Nichols, yes. Janet, do you want to try sending the meeting invite to Gino, please? Kevin, can you let him know Janet is sending it to him?
They both nodded yes.
Yeah. Okay. So can we get an update from Jim Gareppi? Hi, Jim.
How's it going? So let me just give you an update from the last meeting. After the Board of Health meeting on the 14th, the board voted to advise people in Littleton to wear masks or face coverings. So a notice went out to all of the food service businesses with a template of a advisory and a request for them to post on the door. So those went out first thing Saturday morning. Our food service inspector had put out on our Facebook page a request for people to donate homemade face coverings so that she might be able to give them out to those people who don't have them. She's gotten tremendous response to that. So as she's doing food service inspections, she's bringing the cloth or homemade coverings when she does inspections and offering them to whoever needs a face covering in the stores and restaurants. So she's doing that part of it. Again, she's gotten tremendous response and people are happy to receive them in the places that she's going. We're still doing our daily phone conversation with LifeCare. And when I say daily, it's 7 days a week. And so our role as the Board of Health is to make sure that we can do our isolation and quarantine component of that. And we're making sure that if people are released to the community, they're being released appropriately. And there are at least 3 Department of Public Health employees on that call too. One is the licensing agent, one is a representative of the epidemiology department at the state lab. And then there's one other person who's new, I think, to last week to the call, who sounds like maybe more of a someone who's more knowledgeable about the operations of the facility. So it seems to be well covered on this call. So again, those calls are happening every day. The state, you may have heard that the state talk about, or Department of Public Health talk about this new contact tracing collaborative program that they're standing up kind of as it's going along to assist boards of health in their contact tracing efforts. So as cases come in, positive cases come in, the local board of health can keep those cases, or they can send them to the contact tracing collaborative to actually do the contact tracing component of it. They held a webinar yesterday to explain it to us. It will go live for the entire state May 1st. Myself and Tamara Bernard, who's the public health nurse, were on that webinar, and we're going to try to get some additional information about how it will work and decide how we would integrate it in what we're doing. Because they're doing this on the fly, we're concerned about access to data, how we might be able to provide data to public safety officials. So we want to get a little bit more information about how it works before we kind of jump in. The other part of that collaborative is any complicated cases. So a case like the nursing home where there's multiple individuals, those cases would always remain in town. So any difficult, complex cases would remain in town regardless of the contact tracing folks. The Attorney General's office has a new website called frontlinema.org. It's for frontline workers. It's a nice, quick site to get information for employees of the Commonwealth about information regarding COVID-19. So if people want to check that out, again, it's frontlinema.org, decent website. I think, Scott, the thing you provided last week about the face mask advisories, I think that was posted up on that site there too. So the number of cases in Littleton's increased by 1 since Friday. So we've had one case in town. And I think that's all I have.
Thank you, Jim. Does any board member have a question for Jim?
This is Mike, Jim. Just a quick one. Has there been any discussion about what the state has in mind for, shall we say, launching a change in the posture about essential and non-essential services and establishments? In other words, what in their view has to happen in the state in order for shall we say, a loosening of the restrictions on movement and public gatherings? Any ideas along that line?
So in the number of Department of Public Health calls that I've sat in on, they're not giving us any kind of firm and fast information. They said the governor's looking at the data, looking for a significant period of time where things are flattening out or turning the other way. A lot of the calls are around particularly things like camps, beaches, and pools. Again, no guidance on that yet. So kind of the long answer to your short question was no, there's nothing firm and fast for us. But one thing I did remember when you started talking was as far as data goes, for people who are looking for more data, if you go to the DPH website, the Corona page, and click on the daily updates section, they now have about 22 or 23 pages of data, including graphs and hospital information and cases by county. And so it's a wealth of information if you really want to look into the data part of it. So.
Yeah, actually, it was looking at those pages that got me to ask the question, because it looks as if the state is not even close to anything, whether it's testing or any of the other stuff. I mean, we're just getting around to it.
So if you look at there's one of the pages that has kind of a chart of the daily percentage of people who test positive. That's kind of seems to be evened out at this point here. But that's the only thing, and that's the only thing I noticed that's kind of leveling, if you will, and not even leveling. There's still some spikes here and there. So
I think maybe that what might go along with that is the opening back up of restaurants and stores in town, and how we want to handle that in the future. They're just keeping the sneeze guards in place until, I don't know, extended time. I don't know.
So again, on the public health calls, they were the boards of health really were looking for some guidance from the state, as opposed to doing all the individual guidances themselves. That way, people, a franchisee isn't dealing with a whole bunch of different community guidances. They're dealing with one state guidance. So again, those are just the things we're hearing on the public health calls.
Okay. Any other questions for Jim?
I had one, but maybe we can talk about it later.
Sorry,
Jim,
Kevin.
can you hear me?
Yeah.
It was about the email that you sent us and the liaison to the regional public health people.
Sure.
Is that something you want to talk about later, or?
I can talk about it now. So the Department of Public Health has, I guess, individuals who can serve as a liaison between the Department of Public Health and the local Board of Health if somebody wanted that. We kind of serve that role for you. We're on the public health calls. We're passing on the information. So I sent it out because there was an inquiry from the state saying, Jesus, do your boards want this kind of a liaison? So it's entirely up to you. I can provide your information to them, or we can continue the meetings as we're doing. And so it's really up to you. It's an additional person, if you would.
So why would we use it if you couldn't answer a question for us, or if you were just inundated and
I guess that would be the case. Or if you had a question, you could, at this point here, any questions that you have that I can answer, I can always send up the DPH train, because I'm on calls 4 days a week. I'm on a DPH call.
Okay.
So I can always send it that way. So I think from the state's perspective, they'd rather have it go through, particularly where towns are parts of districts, have them go through the districts and go to DPH. But again, they made the offer, so I sent it out to the boards.
Okay, thank you.
Kevin?
Jim, just a quick question, and I don't know if you know the answer to this, but can mosquitoes carry coronavirus?
I do not know the answer to that question. So we can certainly find out.
Yeah.
Okay.
Well, yeah. If it's any help, Kevin, fruit flies can, but with great difficulty.
Interesting.
They have a chitin exoskeleton, Kevin. Makes life a little difficult for the virus.
I wonder if because it's an aerosol and not bloodborne, mosquitoes might not carry it.
No, it's their chitinous exoskeleton. They're covered with this. Think of a very, very small lobster. And then you gotta, they all have these little, it's all chitin on there. They have exoskeletons.
Good to know.
Okay. Anybody else? Is that it for questions for Jim? Thank you, Jim. Scott, you're up. Do you have updates for us?
There we go. We still continue our responses up to the life care and throughout town actually. Life care seems to have kind of leveled out a little bit, so it's a little more of a back to normal basis. We are, and like I said, still responding around town. One thing to note is the Emerson Urgent Care. They have dedicated half of their facility to COVID, and they've taken the other half, basically the right side of their facility to typical healthcare. Just to have that segregation. And then starting today, they have a by appointment drive-up testing. So that started today, and that they're going to let us know if that's going to change in the next week or two. Not sure if it's going to ramp up to random testing or just stay by appointment. But their other facility in Hudson is closed, so they're directing everyone in the area to the Littleton facility. But as far as our PPE, we're still in pretty good shape. And, I think, as Jim said, with people with masks going around in the other stores is definitely seeing an increase on people not only working in the stores, but the people that are, shopping actually are all wearing masks more. Not everybody, but it's definitely an increase. So it's good to see.
Yeah, I agree. I went to the Common Convenience yesterday, and the owner was behind the counter and he had a mask on. I had my mask on. Everybody came in, had a mask on. He had his sign that we sent him. It was up on the front door, so it was all good to see.
Good.
Does anybody have a question for Scott?
I have a question for Scott. If you happen to have noticed, are you seeing a pretty steady number of calls involving, I'll call senior citizens, not necessarily all COVID related, but has there been any fluctuation in the frequency with which your group has interactions with them, where they have difficulties, COVID or not, during this period?
Not sure if I'm following you. We have, I wouldn't say there's a swing one way or another, whether it's younger versus older. We've definitely seen some more, some of the older generations with some of the respiratory issues that are COVID related.
But no change in frequency, you would say, other than maybe, in other words, it sort of reflects the incidence of COVID, just using it as an index. The total is very little change.
You know what? I think, honestly, the people that are COVID related are sick and want to go, seek the medical attention when it gets bad enough. And I think we're starting to see, along with some of the other towns, people that are sick in general are afraid to go and seek medical attention. So it almost, their conditions worsen until they hit a point where they need to call the ambulance and to seek medical attention. I think honestly, a lot of people are just afraid to go to the hospital because of, everything being COVID related. They're afraid they're going to get sicker.
This may be a question for both you. I asked this question just to get at that because I heard it anecdotally from the folks at Emerson a little bit. Jim and anyone who actually knows can weigh in on this. Is there anything that could be done from a public health point of view to advise folks who are, let's just say, have illness, and that's just broadly speaking, to reduce the level of apprehension of going to, let's say, Emerson or any of the other very good healthcare centers? Is there anything worthwhile to do that overcomes what we'll call the COVID fear? I'm not trying to diminish it. I'm trying to see, because that really makes things even harder to have folks who are sick, whether it's COVID related or not, and afraid to get help. It adds burden all the way around to them as well as to the public.
It's honestly, I think it's a tough situation. I'm not going to encourage anybody to go to the hospital if they don't need to. If they can seek telehealth and at least, speak to their physician or, try to get some initial treatment without going to the hospital, it would be recommended. And
It's what? I'm sorry, I didn't hear that. What you said?
if they could see, take the telehealth option or speak to their physician instead of just jumping the gun and going to the hospital. It keeps that option of exposure, very limited.
No, agreed. But I got the hint from you that they're not seeking medical help, and they're ending up in the ambulance when it's, shall we say, more serious.
That's what it appears right now. Yes.
Okay. So
So Mike, could we maybe talk to the senior center and see if, I don't know if they have a mailing list or an email list that they could send out a message, and we could craft something if you'd like, kind of advising people that, seeking medical attention when needed is important, and, don't wait until, you need a ride in the ambulance kind of thing.
Yeah.
And whether we had a mechanism by way of the senior center or the Council on Aging to get that message out.
excellent. And do any other members of the board feel this is necessary or would be helpful?
I agree. I think it can't be anything but helpful. I think it's a great idea.
I agree.
Let me draft something and send it to you, Louise.
Thank you, Jim.
Thanks, Jim.
Yep.
Thank you, Mike. And are there any other questions or comments for Scott?
I'm just assuming, Scott, since you haven't mentioned it, you have enough equipment for your personnel. Everything is pretty well stabilized. Is that the case, or is that just wishful thinking?
No, at this point we are. We're pretty stable as far as PPE goes. It's a pretty steady state of calls right now. If it were to increase, that may change, and if it does, we'll reach out to MEMA for additional supplies. But right now we're comfortable.
I just want to say, Scott, that COVID command center email that you send is amazing. There's so much stuff on that. Janet, we should make that available on our somewhere, because you said last week, Scott, that it was public knowledge, but it's got so much stuff. It's got 1-800 numbers and hotlines on it. Really, people can really get a lot of their questions answered from it. So I don't know if that's something we can link to a town website or Board of Health website, but I think it would be something good, valuable.
I do. I send that out, it comes in usually around 10 o'clock at night. And so I try to pass that on, and I send it to Kirby and stuff. So I think between the different groups, there's little bits and pieces that can be taken out of that and, posted on the website or maybe even LCTV.
I did speak with Joe Leiden about that last week, and he said he was going to take pieces of it, such as you suggested with the washing of hands and how to do takeout food and go to the food store and what have you. So I haven't double checked to see if any of that made it onto the website. And I know LCTV does have some links as well that are on their cable station. So the stuff that doesn't get outdated every day, they are trying to put on those links.
I just don't think that you know exactly what everybody is needing. Today I looked at one of the ones and it had a big map of the Massachusetts, and it had food banks and house of worship, and you just don't know what people are needing. Some people need the mental health aspect, some people need the food aspect. So limiting what we post, picking and choosing what we post may not be whatever, to reach more people, you may want to put the whole thing up. Or just have it be wide that it can be used. So
What percent of the town, I'm sorry, what percent of the town does not have? Does anyone know I heard a figure a couple of years ago, but what percent of the town does not have residents do not have access to internet?
I have no idea.
No, I-
It just struck me as being very high for a small town a couple of years ago, but I don't know what it is now.
I would say that's maybe somebody from the library might be able to answer that, for
Yeah.
the amount of people that go in and visit the library for internet service. They might have a good idea.
Yeah. Because it seems to be a concentration of people with, limited resources to begin with. This makes everything worse, as well as other folks who find working a computer a challenge, all of which is understandable. So it's spreading the information. I think Lisa put her finger on a nagging issue, is that, yes, there's a lot of information out there, but it's amazing how many people can't access it, or if they do, they can't work their way through it.
Well, hopefully those people that don't have access to internet would call the office, the Board of Health office, and speak to Janet, and Janet could refer them to Jim Gareffi or to some other source. Hopefully that would be their response, or to call their PCP.
And Littleton Cable TV, Judy, yeah, what do you guys have on that? Because if you might not have internet, but you might have TV.
So if you have TV and you're looking at either Comcast or Verizon, we have been running since the very beginning a special COVID-19 bulletin board slide in between all of our programs that has, I just switched up the hand washing video from the CDC video to Sesame Street, and I'm trying to download the stuff that was in that newsletter that you've been talking about on all of their different, they've got 7 to 10 30-second to 60-second videos. So we're trying to rotate those in. We have all sorts of food resources that we've worked with different churches and different food banks around town. We've definitely been working with Loaves and Fishes. Loaves and Fishes is actually reopening on Friday, and they're going to be open 2 days a week. So that's awesome news.
Yeah, that's great news.
As well as we've been airing different churches that have been sending us their recorded services. So it's about a 12-minute long community bulletin board before it rotates now with just all sorts of information on it. And it's available online, it's available on TV, and as many places as we can get it.
That's great. Thank you, Judy.
Okay.
Okay. Anything else for Scott or Judy or Jim? Okay.
Quick question. Can I ask? I don't know if it's probably for Jim, and it might be a little premature, Jim, about reopening. I had a friend of mine who works for Littleton Lumber call, and their store is closed, and they're doing curbside orders and things like that. He was wondering if he was talking about a spray in that people on some news shows he's been seeing. Stores being sprayed down with anything. Is there anything, again, it's reopening and we're not reopening it. Like I said, it might be a little too early to talk about it, but is there any kind of surface disinfectant that people are recommending at all for establishments yet? They're just trying to get a little bit ahead of the game.
So I think hopefully they're disinfecting as they're going along now, particularly anybody who's open, and then any kind of a situation that they have. I mean, we're starting to get dribs and drabs of report where somebody has been at work and then has left because they weren't feeling well. So we typically advise them to go up to the CDC website, follow those directions for cleaning and disinfecting. Something as simple as bleach still works as a disinfectant. And again, it's not that you need to. There's this continuum about over disinfecting, if you will, and doing it when it's necessary. And so I think in the normal, kind of increasing your daily disinfecting is probably good, just to hit in things like doorknobs and door handles and bathroom faucets and stuff like that. But I'm not sure there's any special procedures or any special process that needs to happen to reopen places.
Okay, so next up is going to be Alex McCurdy. He has a presentation for us.
Hello, everyone. First, a little update on what's happening statewide in the MRC stuff. There have been a number of requests that have come through for skilled nursing, mostly for long-term care facilities. None of those have matched up with what we have the ability to help with. And actually, it probably has slowed down a little bit. There hasn't been any activity in 24 hours of emergency. These are so-called emergency requests for additional staffing. Some of them were the requests were for staffing within hours of when the request went out. So perhaps it's a good sign that we haven't seen any of those today. So I do have one slide I'd like to share on the screen if the board will indulge me to talk a little bit about a step that is still ahead of us to be made. I will attempt to share the screen here. Okay, everybody see my slide there?
Yes.
Okay, so one of the positive things that's been coming out of my daily interactions with the Medical Reserve Corps was getting in touch with a planner whose job is to work on certain planning activities for the region. I had spoken with the person about updating our EDS plan, which is an emergency dispensing site plan, because it has not been updated in a while, and I'm pleased to say we've had a number of dialogues. So this is a project that's between myself, the chief, and Jim Gareffi that we're looking to update. So I wasn't sure how much the board knew about this, but it first started appearing in 2013. The last full update was in 2015. Since then, there was an update, a general update to deal with anthrax. But what it is it's a community-based procedure for dispensing medications or whatever it may be. It could be shots, it could be pills, it could be whatever. We would be expected to be, as a whole community, would be expected to participate in that. The lead agency is the Board of Health. That's your board. And through that, that Jim Gareffi would be heavily involved. Those are the people who would be actually administering dosages and stuff like that. But there's a lot of other things that need to be done. So this plan is supposed to be ready to go in about 24 hours when it's called upon. It requires a state of emergency to happen. Emergency management and the Medical Reserve Corps end up being key elements of getting it so it will work. And all the other town departments, from cable TV down to DPW, would be involved in the process. So the goal of this plan, the goal of what we're working on right now, just so you know, is that we are going to update it under the new reality that we are all in the middle of. And hopefully by the time this kind of thing, I think the chief and Jim and I agree that this kind of thing may appear when a vaccine becomes available. And so we need to be ready to go with it. So that's what we're working on. I don't know if anybody has any questions.
I'm a little uncertain about who the "we" is. I'm not quite sure what the volunteer corps. I can understand Jim and Scott being heavily involved in this, along with other parts of the town. But I'm just wondering, as well as the state, is what particular professional, shall we say, crisis and disaster management recovery expertise is within the volunteer corps, especially in view of the lack of medical expertise.
Well,
yeah, I mean, it's not a criticism. It's just I'm just wondering best use of time and resources.
That's actually a good question. The Medical Reserve Corps is a broad base. Now, the Volunteer Corps includes the Medical Reserve Corps. The Medical Reserve Corps, from a region and statewide basis, is heavily involved in the planning and dealing with these kinds of situations. So the local MRCs become involved. And in fact, it was the chair of the MRC who generated the 2015 plan. And she generated that while while she was still chair and a member of the Board of Health. So the MRC falls under the jurisdiction of the Board of Health, which makes us so that we work for you. But we provide our role, for instance, when we did an exercise in this in the past, was we provide a lot of the logistics so that the medical professionals could work along more efficiently. And it requires a great number of people who are not necessarily medical professionals. It's about a team coming together to get through a lot of things in a hurry. So that's what our role is. The MRC statewide is pretty much taking lead in this role for quite some time. And so that's how we end up in it.
Alex, I was reading your email. You're not going to do a drill or anything during this time or anything like that.
The goal is to have a drill before the time comes that we might have to use it, because it's a pretty complex operation when we do it. So it's not going to be a drill in the next few weeks. The goal would be to have a drill sometime before September, something like that, in that area.
I have a sort of a functional question here. Just suppose, and obviously it's a big supposition now, let's just suppose that somebody with his head screwed on right got the early warning that was provided through the appropriate federal office that picked up the first clues of what was going on in Wuhan and elsewhere. And it was basically appreciated and widely dispersed. What role would the plan as currently constituted, in what way was the current plan deficient? Let's say it come down the ranks as it should have. Get ready, we're going to be facing a pandemic. Okay, so
are you referring to the timeliness of the plan that's currently in existence?
Yeah, my impression is, and I just want to make sure I understood, that plan basically is very anthrax. It's basically built for anthrax, not for radiation or much of anything else.
That's not the case. It's built for it was ramped up and was made ready for H1N1. And anything where there's a declared state of emergency and you have to run a dispensing site for a large number of people. So each community, if it was a large scale operation, each community would be involved in doing one of these. So it's pretty broad based at what it can handle. The last update was relative to anthrax. The one before that one was H1N1.
The Medical Reserve Corps portion out of this, like for the EDS, the emergency dispensing site, it's basically, an inoculation site, mass inoculation. And, so for anything, whatever, be it a COVID vaccine or, anything else that may come up, the MRC and the Volunteer Corps would actually basically do the support function, and it would run in conjunction with the Neshoba Board of Health, where their nursing staff would, most likely administer the inoculations, and we would be more of the support that would set up the the processing of it, the paperwork of it, keeping track of everybody going through the system. So it would be working in conjunction with the Neshoba Board of Health. It's not necessarily a dispensing site that is run solely by the volunteer corps. It would be again mostly a support mechanism. Establishing it, setting it up, making sure that it has smooth flow, so that the Board of Health can go through, and the nursing portion of it would be able to administer those.
Mike, if I can add on to what both Alex and Scott said, the current iteration of the plan, the assumptions are for an anthrax situation, because the previous one was looking at a vaccine. They realized that the nature in which you receive vaccine didn't really work that well with the model of a dispensing site. Though we did, as Alex and Scott mentioned, we used those flows, those plans, building plans and logistic plans to actually run all the H1N1 clinics that happened. Our office, Neshoba, our nursing staff worked with all of the communities and those plans to set up these vaccine sites when H1N1 came out. So we actually have had an opportunity to actually exercise that operation using a vaccine.
I think the important thing is that to do one of these requires all hands on deck. It requires in the fire department, it requires the volunteer corps, it certainly requires the expertise of the people who are actually going to do the administering. But it's a big project. There's a lot of people cycling through. If you look at a rough example would be when you look on the at the news reports of test sites, and you look at how many people are necessary just to get that person funneled into the point where they actually are tested and get out. There's a lot to be done, and it's going to be under duress for a lot of people because it's been declared an emergency, and they're going to be rushing in to get this done. And it's just a labor-intensive operation.
Yeah, make no bones about it. It's not a few people that are just volunteering to come in and set this up. This is a major undertaking that would, obviously, just like Alex said, fire, police, the volunteer corps, the Neshoba Board of Health. It's a very significant undertaking once it starts. So for something like that, if it were to take place, it's not a hey, hop in with a few volunteers and let's set something up. You need to follow the plan, and it's very manpower intensive.
So Alex, will you let us know when the drill is happening and
Oh, absolutely.
how we can get people to volunteer for you?
The last drill we had, we really, and this was in 2015, we really did a small scale version to get a better read on how the plan is going to work. We would really like to get a lot of volunteers, and the Board of Health would obviously be in the middle of it. The schools would be in the middle of it, but the more people we can involve in being in the drill, both as people who are conducting the operation and people who are acting like they are there as getting services from the dispensation site, will make it all the better when the time comes and we actually have to make it work. So it'll be widely known that this is going to be done.
Yeah.
The more, the better.
I think getting volunteers, depending on the situation, like an anthrax or tornado, this COVID that we're in right now, your volunteers are going to be dependent on who feels susceptible to this. So you're going to get some people that are afraid of COVID and they don't want to go out and volunteer, but they've signed up for volunteering if there's a tornado or a hurricane or something like that. I think the situation is going to be different for everybody volunteering. Just a comment.
But I think that's pretty much a known in who would be involved in certain things and who wouldn't. But you have to remember, this is what we train for. And this and tornadoes, and we train for a lot of different things. And yeah, we won't have 100% of our people participate in this, but they're all trained, and we have to do a situational assessment when it comes.
If you're looking at a situation where you're dispensing something like a vaccine, the vaccine works, then all the folks who are contributing would have to be obviously vaccinated before they can go out in the public and attend to matters where they come in contact directly or indirectly with unvaccinated individuals.
That's actually an element of the plan.
Yeah. So basically, as I hear it, this is mainly meant for, shall we say, when we have a fairly good idea that we have a firm idea that we have shall we say, a vaccine or something similar to protect the general public that makes all of this, from a public health point of view, effective. That is, that the public can be protected against further, shall we say, contagion. That's the idea of what the plan is going to be focused on.
Yeah, that's essentially what it is. What we're required to have this plan, and it was built all around that. What you just said, just it's a way to get people, when there is an effective treatment, to get the whole town done. So the whole point of the update is essentially let you know that we are working on updating the plan based on the new reality. That's the 10-second version of it.
So so basically the earlier a vaccine is developed, that would not change your plan, correct?
The plan would flex, and Jim can speak to this too. The plan would flex based on what it is we had to accomplish. There's a big difference between giving somebody some pills, which is what the anthrax one was going to be about, versus giving people inoculations, which was what H1N1 was about. So
if I could touch just a little bit on that, I mean, at the beginning with the H1N1, I don't know that the plan was, it was designed to administer some kind of vaccine at that point, but it just fit nice with what was happening with H1N1. And the way vaccines were rolling out at that point, initially when we were getting vaccines for the town, we'd get 25 doses at a time for 16 towns in a district. So once we had enough vaccine, that was one of the reasons why they changed the assumptions in the original plan, because it's hard to set these things up if the vaccine's just dribbling in. But what we did do once we had a critical mass of that vaccine, we started setting up clinics. And again, the clinics early on with the H1N1, there were very strict guidelines on who could get that vaccine. And so that was incorporated into that plan and the messaging for people coming out for that. So as Alex said, one of the things it wasn't as big a concern with the H1N1 doing the force protection, but certainly in this case here, given COVID-19, if we were called upon, if there was a vaccine for us to administer in this manner, I'm sure that would be a pretty big part of that plan.
Is there any other comments or questions for Alex? Okay, I guess we can. Thank you, Alex. I guess we can open it. Are there any comments or questions from our attendees, Janet?
Nothing that I'm seeing, no. No hands
Okay.
are raised.
I'm sorry?
No hands are raised.
One last thing, I would just like to take a minute to remember Kathy Knox, who passed, not from COVID, but she was a well-known figure in town and very helpful and to a lot of town charities and well-known. So I would just like to take a minute and a moment of silence for her. Okay, thank you. And our next meeting will be Tuesday night at 7 o'clock. It's a regular Board of Health meeting. We will not be discussing any COVID issues. And then the next COVID meeting will be the next day, Wednesday, the 29th at 2 o'clock. So hopefully everybody can make it for Wednesday at 2 o'clock on the 29th. Are there any other issues we want to talk about before we're adjourned?
Janet, how's the agenda look for Tuesday night?
So far, we have one public hearing.
So far. And I'm going to give you some virtual flowers today because it's an administrative assistant. Virtual flowers. Thank you for all you do, Janet.
Thank you.
Yeah, I would like to give kudos to Janet because you have been full of your tasks are above and beyond what you've had to do along with all this new technical stuff you had to learn. So thank you so much for everything.
Pajamas though now.
Okay, I think that's everything. So would someone like to make a motion to adjourn?
I'll make a motion to adjourn.
I'll second it.
Okay, Kevin,
Kevin Baker, yes.
Lisa,
Lisa Flanagan, yes.
Michael,
Mike Zeldin, yes.
and Louise Nichols, yes. Thanks, everybody.
Thank you.
Thanks.
Thank you.
Bye. See you later.